Hi, this is Dr. Cox. Prior to joining Alpine Pediatrics 7 years ago, I worked for 3 years at the Centers for Disease Control, uh, and I was trained there as a disease detective, specifically interested in respiratory diseases. I continue to be interested in outbreaks, and I want to share a couple of things that I hope you'll find helpful in understanding the current COVID-19 outbreak. So the first concept I'd like to share is something called a transmission rate. So a transmission rate just refers to how contagious a specific virus or bacteria is. So think of it this way, that if person A has a disease, how many more people will that person pass it on to? So that number for measles, which is highly contagious, is around 15. That number for COVID-19 is a little bit more than 2. So in this diagram, you can kind of see how that plays out. So if a sick person who has COVID-19, that person is going to pass it on to likely 2 other people. Those 2 people in turn are going to pass it to 2 additional people. So in this particular example, where an entire population is susceptible, the total case numbers go from 1 to 2 to 4, 8, 16, and so forth. And that's why at the beginning of an outbreak, you start out with very small numbers of cases, and then as we get to doubling over and over again, we start to rise, consistent with what other places, including New York City, are dealing with right now as they get to that exponential rise. The second concept I'd like to share is something called herd immunity. Herd immunity refers to protection from a disease that occurs when a large percentage of the population has become immune to that disease. And that can occur in one of 2 ways. It can occur either through infection, being infected with that virus and then recovering, or through vaccination. Now in the United States, our herd immunity for most severe diseases comes through vaccination to those diseases. So going back to measles as an example, most of you who are watching out there never contracted measles as a child, but you were vaccinated for that disease, and as such, you've never been sickened with that. Also, if we can keep the number or percentage of the population who've been vaccinated for measles very high, then we can essentially crowd out that virus so it can't circulate in our community. So one question that likely a lot of you have right now is, well, when will this COVID-19 outbreak end? It already seems like it's lasted an eternity. Now, the ending of the outbreak actually has to do partway with that herd immunity concept that based on the transmission rate of around 2 for COVID-19, the herd immunity that would be required for that virus to essentially die out would be right around 50%. So when around 50% of the population is immune to COVID-19, then that's when the pandemic essentially is going to decrease and go away. So let's again look at this same example, except for the difference in this diagram. The yellow individuals in the diagram are considered immune. So either they've contracted the illness and gotten better, or they've been vaccinated against COVID-19. So in this example, a sick individual, instead of infecting 2 other individuals, now will only infect 1 other individual. That individual is going to go on to, again, only infect 1 other individual. That outbreak then simmers and eventually decreases and goes away in this example. Again, when you have a population where 50% of the population is now immune to that virus. So what does that mean for us going forward then? So what it means is that this outbreak is going to end when 50% or around 50% of people are immune to this. Now, the 2 ways you can become immune are to become sick from the virus and to recover, or to be immunized. Now, that first option of becoming sick with the virus is not a great option. In fact, if you think about the population, for instance, of the United States being around 340 million people, that would mean that 170 million people in the United States would actually have to contract the illness and get better in order to provide the herd immunity we just discussed. And that, if you broke that down to a daily basis, that would mean 500,000 people every single day would have to contract that virus for an entire 12-month period in order for us to get that herd immunity necessary to keep that virus out. To this point, we've only had 250,000 total cases in the United States. So if that gives you kind of a sense of what we're up against there. So really our best option is to suppress this virus for as long as we can to keep it at bay until we have a vaccine ready to go. Now that vaccine's not going to be ready until about 12 to 18 months from now. So it's going to be a while before we get to that point where we can get enough people vaccinated that we can now drive that virus out. So hopefully those two concepts can help you to understand a little bit better about what we're up against when we have a new disease that enters the population. I will say that I think we've got a real, to put kind of a silver lining on this, I do think that Utah is in a good position. I think we're led by very good leaders, both in the public health department, in our government, and in the hospital systems. And I think that the measures that Utah has taken to this point to keep this virus at bay have worked and will continue to work. And I'd encourage each of you to listen to the guidance that we're receiving regarding social distancing and others, and to really follow that guidance, because that's the best way that we as a community, as a society, can move forward and get through this pandemic. Now here at Alpine Pediatrics, we continue to work to make sure that your kids are safe and healthy. And one of the biggest things we talked about in here, it's important that children are vaccinated, not just for COVID-19, but other diseases. And we continue to do well checks just as we always have been. And we encourage you to come in and see us for those well child checks. In addition, if your child has fever or cough, we're sending anybody with a fever or cough to our Orem Clinic office. At that office there, those providers that are working in that office are going to make sure that your child is safe and protected at that office as well. Please be aware that this is going to take a little bit of time to get through, that we're going to get through it together, and it's going to be okay. And know that you and your children are going to be okay. And if we can help you at Alpine Pediatrics, please let us know how we can do so. And we'll be back with further updates. Watch for updates on our social media account as well. Thank you.